welcome to Understanding Depression, Hope Through Treatment. I'm Mary Hanson. I'm a social worker and host of a long-running cable and public television show that has focused for years on social and health issues. My co-host today is Dr. James Jordan. Jim is a well-known psychiatrist in Minnesota and the Midwest. He's the past president of the Minnesota Psychiatric Society, and he is the man who was at the helm of the Ham Psychiatric Community Health Clinic in Minnesota in St. Paul for 25 years.
Welcome, and we want to talk to you about a common and important and serious public health problem, depression. Our guests are going to talk to you about this in terms of how it impacted their life, and we want you to learn from these discussions with our guests about how you can help yourself and your family in the future when and if this common problem comes into your life.
In this next segment, you're going to meet a Minnesota State Senator who talks very openly with Dr. Jordan about his serious and major depression. Stay with us. We'll be back in just a minute.
Hello, I'm Dr. Jim Jordan. I'm a psychiatrist. My guest today is Senator John Hottinger. Senator Hottinger was a state senator for 16 years and also our majority leader. He's here to have a conversation with me about the topic of depression and his experience with depression. Senator Hottinger, thank you for coming. Can you tell me about your experience with depression?
Well, certainly I'd be happy to, and thank you for inviting me. I appreciate it. I'd always had some challenges with anxiety, but dealt with it, or at least I thought I did. In 2003, there was a conjunction of a lot of pressure. In my legislative role as majority leader, we had the first of the big budgets. And in addition, there were some things going on in my personal life. That triggered a really active event. I often talk about it, and I talk about it in the context of being on the bridge next to Regent's Hospital getting ready to jump in June of 2003, and having at least the final good sense of calling a friend, having some friends intervene and getting me hospitalized. It really woke me up. I was treated for anxiety and extensive treatment for the depression, and in retrospect, it was one of the best things that ever happened to me.
Can you say more about that in terms of what that really meant in terms of your life and how it affected you at the moment that you began to have those kinds of experiences?
Well, it was certainly dramatic, and I would have been one of those people that no one would have understood that I had done it because I hadn't shared my anxiety with anyone. But standing in that bridge was an eerie feeling because I was there because I wanted to jump. I'd been up about 40 straight hours. I couldn't sleep, I couldn't do anything, couldn't eat, and just it didn't seem like there was anything that was positive. I at least had enough left to contact a friend, and that's what saved me in retrospect.
So you lost all hope at that point?
I really did at that point. And I don't like to get blood tests because they hurt too much. So it was quite a profound recognition by me later to think I was willing to do that when the pain of a blood test bothers me. But it was dramatic, and it was something I think about, of course, a lot because I realized how bad I had gotten, how bad the situation had gotten.
So a marker really of how serious your condition was at the time, having these feelings.
Right, that's why I talk about it right at the beginning of any time I talk about my experience, is because it was the marker, it was the identifier that finally got me to get the help I needed. And the helping personnel I had at all points, the hospital, the treatment I received, they were just great. I can't say enough about them. But standing in the bridge was the fateful moment for me. Could have been a very fateful moment, but it's the one I go back and think about and say, I don't want to be there again.
Now, take me to the point where you began to get some help for this. How did that transpire? Who helped you?
Well, as I said, I called some friends who I'd worked with in St. Paul over the years. I was in the legislature 16 years. I had been for 13 at that point, and I called some friends, including a staff member who worked for me. There was an irony involved in that. She picked me up, and for some reason, we went to a coffee shop to talk about it, which was good, except we ran into friends, and it was a little challenging dealing with, I'm sorry, I'm about to commit suicide. We won't talk with you right now.
I see.
But we did talk with them, and then she took me to the hospital. I got checked in and ended up having a room. I was in a locked ward and ended up having a roommate from a very different background, and we helped each other. That's what was so amazing to me. I got some medication, of course, right away for the anxiety, but the guy I ended up being in the same room with, although we were from totally different backgrounds, we talked to each other about our problems, and I was amazed how much even that was important,
So
because
you were
somebody was listening to me.
beginning to talk about
Yeah.
how things were for you,
Yes.
how things had built up to your roommate.
Yep.
And some medication. What was that like? How did the medications affect you?
Well, the medication, I think, was it was for both the depression and the anxiety, but it was really directed at the anxiety, which was driving me crazy. And it was bad use of terms. It was it helped calm me down, I guess, is the easiest way. And then there was intervention from a psychiatrist who talked to me, and he was just great. I was there for 3 days, and unfortunately he was moving to Boston, but it was finally talking it out and admitting it, acknowledging it. That was a very important part of it.
So you were able to acknowledge the
Right.
depth of this, the pain of this, and the anxiety was the major symptom you were having.
That's
They gave you
correct.
medication for that.
That's
The
correct.
diagnosis of depression was made at that point?
Yes, it
also?
was, and that was part of those pretty intensive first 3 days. And we worked out a treatment plan, and it was a lengthy one ultimately, 6 months, 3 times a week, 3 hours a day, in a group situation, something I would have never envisioned that I would be comfortable with.
Group therapy.
Correct.
All right.
And it was as I said, a really good experience, partly because you know you're with other people who are having the same struggles as you are, some even more intense, and you talked about it, and you shared your, there was some we were anonymous to each other in terms of our names and specific backgrounds, but it was an opportunity with a facilitator, a mental health facilitator, of course, who helped lead us that way. And you could participate or you didn't have to participate. It was just a great opportunity to address my own feelings and recognize the challenges I had and accept them.
And these were all the stress that built up in the context of your work at the time.
Well, that was certainly a large part of it. As I said, I was a majority leader at the time in the state senate, and it was the first one of these big budget deficits that we dealt with.
I see.
It was Governor Palente's first year and my first year as majority leader, and it was very stressful for all of us. I just reacted a little more intensely.
So the stress could be the precipitant here of this depression.
Certainly, I'd actually been, I don't think I've ever disclosed this, I'd been in the hospital a week earlier for an afternoon because my staff sent me over because I was having physical manifestation
I see.
of the stress. And I went over, the doctors told me to go home and rest, and of course I went back to the Capitol. But I didn't follow my doctor's directions very well. So it was coming on even in a physical manifestation earlier.
Not an uncommon thing for doctors to see their patients come into the office with a physical complaint. That's a manifestation of anxiety or stress building up.
I can believe it. I was having chest pains, and so my staff was appropriately concerned that I was having some sort of heart action, but that's what they tested first. They said, no, heart's fine.
Okay.
So.
All right.
It was a warning sign.
Was the medication continued through this period of time that you were in the therapy, the group therapy, and you were getting better, you were feeling better, you were opening up and so forth? How did the medication program work for you?
The medication program for me, we tried a variety of things. Well, we didn't try a variety of things. We tried a few things and finally found something that helped. You know, I was also learning a number of tools to deal with the depression in a way that I could handle it myself, but I also needed the help of the medication.
Right.
And we tried a few things. We found something that worked, that made me calmer, didn't stop me from feelings. I mean, I still had good days, bad days, like we all do.
Sure.
But at least it gave me a medical base in terms of the physical changes.
Was that an antidepressant medication?
It was an antidepressant. I still take it. I don't see a psychiatrist except once every 6 months just to check in.
Sure.
But the medication I still take, a lower dosage than I did back then.
So it's been tapered down as you felt better, and now you have a dose that fits, a maintenance dose, as they say.
Yeah,
huh?
yeah, it's a maintenance dose, and I'm very comfortable with it. And I've been fortunate because some of the people I was there with really had a struggle in finding the right message and right medicine and the right dosages.
That can be a very painful thing and difficult if someone's feeling depressed, and then the trials of medication. But you got to one that was helpful, and now over time it's still part of the ongoing maintenance treatment that you have.
That's right, and as I was fortunate because the folks who had more difficulty in finding the right match were very anxious about it.
Now, if you look over your shoulder at this, your experience, and we've covered a lot of ground here in a very, very short time, but thinking about individuals that are out there today, the idea today is that a combination of medication and therapy is really going to give you the best outcomes for the most part with depression. When you think about the therapy, and you said understanding, can you say a little bit more about what are the things now that you see that are part of the insight you have from going through something as painful as a depression?
Well, there are a variety of things, tools that we got during the therapy, and so when I'm starting to feel anxious, I examine it, I guess is the way of putting it, more than I used to, and I put it in a perspective, and I have learned tools. It sounds simple, but I think about other things other than what's distressing me. It wasn't simple before I started this, and now I can do that more effectively because I know what I'm doing, and I know why I'm doing it. So there are tools, there are ways of looking at things and approaching life and approaching stresses that have been very useful as part of the therapy.
John, I want to thank you very much for coming and talking to us about this part of your life, what's transpired, where you are now, and I want to wish you the best of luck in the future.
Well, thank you, and it's like I tell when I give speeches, I've learned mental illness is an illness, not a character defect.
Thank you.
Thanks.
That concludes our interview with Senator John Hottinger. Thank you all very much for tuning in, and we'll look forward to our next conversation.
Conversation that you had with John certainly gives us the insight that depression and suicide do often go together. I read that 15% of people with major depression do end up dying from suicide.
That's right.
Does that seem about right to you number-wise?
Unfortunately, that's the correct figure, yeah.
That's shocking. Well, his very open talk about suicide was riveting. I think we were all listening and so thankful that he found a friend or a friend found him at the right time. If a family member, Jim, is dealing with a person in their family or their world that has depression and is talking about suicide, what do you advise they do?
Well, first of all, take this very, very seriously. Always ask for more discussion about it. And then as reasonably soon as possible to get to some professional help. A family doctor, a mental health professional, someone that can help you assess the situation as far as what is the risk of suicide when someone is talking about this. It's something to be taken very seriously.
I think the human tendency for a lot of folks is to back away and say, oh, you wouldn't do that. Don't even talk about it. And to kind of shut the person up who's verbalizing that possibility. But we shouldn't do that, right?
Absolutely. In fact, this particular symptom, the thoughts of taking one's life, doesn't necessarily mean that one is going to go out and act on it. However, it's not to be dismissed either. You want to explore that just the way a psychiatrist would. You ask someone about how long, how often they're having these thoughts. Are they thinking about specific things that they might do? And then as quickly and reasonably as you can, get them to some consultation and some help to assess it.
I remember years ago when I was working in a clinical setting, learning, and I'm not sure this is still what you would advise, but learning that we should actually ask the person, how do you intend to commit suicide if you are talking about it? Is that still something you would advise family members to pose?
I think so. You could inquire, how far, if they've had thoughts like this, have they made plans? That takes it to another level of seriousness if someone has a plan. But just the general sense of this being an aspect of preoccupation in someone young or with associated factors like substance abuse or alcoholism that might release or cause someone to be more impulsive. These are the kinds of things you want to take very, very seriously and get professional help, get consultation, evaluate what is at risk here, and not to dismiss it or ask someone to keep it to themselves. That certainly wouldn't be a wise thing to do.
Don't poo-poo it. Let's say a child comes to a parent and expresses that horrible wish, and let's say it's a weekend. What does a parent do? What does a friend do? What do you do to keep that person safe when they have expressed that very serious threat?
Well, certainly you don't want to leave them alone. You want to sit down and talk with them. Be sure that you stay close to them. And then if this is something that simply is not going to be able to be managed in some other fashion, you really need to get them to some kind of assessment and some consultation. You can go to an emergency room. You can call for help and get some assistance in terms of what practical steps to take to evaluate that.
I did read just recently that for people who are using drugs or are addicted to alcohol, the risk for suicide goes up. Those are two of the risks or risk factors. Are there others that you know about?
Well, someone that's made a previous attempt, that is something to worry about. Older men, as a group, tend to be some of the most lethal individuals as far as when they have suicidal thoughts, suicidal feelings. This group can be the ones that actually will execute this. And
I've heard that before. Why do you think that's true?
Well, they are in a situation where often they are isolated. They have patterns of keeping their feelings to themselves. This is the style of men, self-reliant. If they have some associated illness, that they're in despair about, or maybe a correlate of depression, heart disease or cancer, these types of health problems. These can all put someone in a situation where they're going to be more at risk. If they have, they've been drinking, as we talked about, this can release, cause them to be more impulsive. And this is a group to keep an eye on for sure. Also young males who are using drugs or drinking and so forth, they can also be a high-risk group.
Another high-risk group.
And keep a close eye on them.
John was talking with you about how much he enjoyed, in a sense, or valued the group therapy sessions that he was part of for a long time.
Mm-hmm.
We haven't talked a lot in this series to date about therapy, what it's like, the benefits of individual versus group therapy. But John certainly felt positive about how therapy gave him some insights. I think he used the word opportunity to look inward.
That's right.
Tell the viewers, if you would, and review for me too, some of the basics about what therapy can do, Jim.
Well, first of all, when you think about the human mind, it really is an understanding machine. It's built for understanding. It's built for thinking through problems, solving problems. So therapy at a very basic level is about using your capacity to understand yourself better in the context of your life. So the idea of, in the case that John mentioned, of the support of a group, for men this is particularly important and helpful for them. They are able to get beyond their self-reliance, talk to others, show that with their strengths they have vulnerabilities, learn things about their past that bear on the present, and also make some plans in terms of some behavior or various things that they need to attend to that could be complicating their life. If they have an alcohol problem, they may need to get some specific help to address that as part of the difficulties that they're having.
Two real specific questions about therapy. How long do you think people should expect to be in therapy if they're dealing with depression or in the cases we're talking about now, major depression? How long should you work with a therapist?
Well, I think the best research that we have in terms of the effectiveness of therapy is that if it's a good fit, you have a good working alliance with your therapist, you're seeing them weekly during the first months of treatment, usually you expect to be in it for months. I would say for a major depressive episode, you're thinking about a good part of a year in therapy. And also taking advantage of what this can be for your life. I mean, this can be an opportunity to really grow and make some changes, alterations in your life that really help you for the future so you don't have a recurrence of the depression. So it's understanding this aspect of your health and then using that, the emotional support you need to be able to change patterns for men, learn to talk about your feelings. So these things, in answer to your question, I would say months usually to get a sustained benefit, and then it should be reassessed.
I think that for many people that would sound inviting. For others it might sound a little daunting, but I'm thinking of the cost. Right now, most health insurance would not cover a year's worth of therapy. What do you say to people who might need a long-term therapeutic relationship but either can't afford it or just don't feel it's in the budget?
Well, in terms of access to care, the clinic I worked at, community mental health clinics, have sliding fee arrangement for individuals that need and can make the best use of individual and longer term treatment. Sometimes after several months of being seen frequently, which is covered under a lot of, in most insurance that provides parity or the comparable care for mental health, then you can go to every other week or once a month, depending on the situation and also the discussion that you have with your therapist, so that you're able to manage and get a treatment plan that's working for you. But I think we really have some improvement to make in terms of the, I guess you'd say, insurance support for this component of care. It really should be on par, on balance with medication therapy, because the combination of the two assures you the best outcome, the most sustained outcome.
It also, listening to you now, makes me think that, wow, a person needs to find a therapist that you click with. You wouldn't want to spend that much time and work that hard unless you were really in a relationship with someone that you felt was your kind of therapist. So that might mean shopping around a little bit too,
That's
right?
right. That's right. And you should feel comfortable with taking an assessment of how things are going. Talk with your therapist about that. And if it isn't working, then consider another opinion, get a consultation.
Well, we are out of time for this particular show. We'll be back again next week, though. I want to thank you for watching. We want to thank John, our guest, for sharing his feelings. We are going to also run a list of credits at the end of the show now in terms of where you can find help if you are feeling desperate, if you feel you just need a good assessment and to start treatment. So look for that. Thank you. We'll be back next week. If you or someone you know is dealing with depression and needs help right now, call 911. If you want to know where to go in your area for an assessment and or for treatment, you may call 211. This number can connect you to mental health resources throughout the United States.